It's every parent's worst nightmare in these troubled times and in the middle of this pandemic. The second wave of the COVID-19 pandemic is seeing children who were previously untouched coming down with the infection in record numbers. There's a huge surge in the number of pediatric COVID cases in just the last 1 month, enough for it to be a special case. Here's what you need to know about why it's happening and how badly.
The second wave of the COVID pandemic has spared no one, not even little children. At an alarming rate now, children as young as 5 years old are getting severely affected by coronavirus.
10 दिन पहले कोविड रिपोर्ट पॉजिटिव आई थी मेरे बेबी की। स्टार्टिंग में थोड़े से लूज मोशंस हुए, बट फिर लूज मोशंस बढ़ते बढ़ते इतने बढ़ गए कि घर पे मैनेज नहीं हुआ, तो इसलिए हम लोग उनको हॉस्पिटल लेके आए। हॉस्पिटल में फ्लूइड्स, आईवी फ्लूइड्स चले और मेडिकेशंस भी चली, एंटीबायोटिक्स भी चली।
At Madhukar Rainbow, a children's specialist hospital in Delhi, doctors recorded 50 pediatric cases of COVID in 1 week.
The situation is indeed alarming compared to 2020 because in this season of COVID outbreak, we are seeing much more pediatric age group, younger age group. So therefore, parents need to be cautioned that we cannot drop the guard. We have to continue with all the precautions and get the medical attention as soon as required.
Doctors confirm that even newborns and infants are turning COVID positive, though their condition is not fatal. But experts add that older babies are at greater risk. At one hospital in South Delhi, a teenager, COVID positive, is battling for her life, dependent on a ventilator. In Faridabad, Poonam Sharma is under home isolation with her 10-year-old daughter since the 1st of April. The whole family has been infected by coronavirus.
On 1st of April, my entire family was tested COVID positive, including my 10-year-old daughter. We were obviously very much devastated, and it was unbelievable for all of us since we didn't step out of the house during the pandemic at all. We were not at all panicky in front of her, so she was quite normal and she thought it was a normal fever, cough and cold. These were the symptoms we all had in our house.
So what are the reasons behind the surge of cases among children? Experts claim a new mutant strain could be responsible, also lack of caution among family members as compared to 2020. There's also the issue of increased exposure, particularly in vulnerable areas, and the fact that there's no vaccine yet for children.
In 2021, globally we are seeing a lot of children, almost up to between 20 and 40% in certain areas, to get infected. The T-cell immunity, the lack of ACE receptors in the nasal passage in the throat, and the other interleukins which are protective proteins in the body somehow don't seem to work.
So as a parent, what are the symptoms you need to watch out for in your child? We spoke to doctors who said that gastrointestinal issues, rashes, conjunctivitis are symptoms to watch out for. In cases of delayed response, multi-system inflammatory syndrome is also a symptom. Most importantly, if you see these symptoms, do not self-medicate and contact your doctor immediately.
Across Delhi NCR, over 25,000 cases are being reported on a daily basis. Many include the pediatric age group. Also across Europe and Brazil, children deaths are being reported. So India would do best to exercise caution and prepare in this war against the COVID pandemic. Pooja Shali for India.
Why is there this COVID surge in pediatric cases? You're probably wondering. Now, we can only speculate at this time because this is still an issue that is in flux. But one of the possible reasons is this is a new mutant strain of the virus that is especially infectious to children. The lack of caution in households, people have let their guards down, could be another reason. The increased exposure of families to vulnerable areas, people have been going out after the numbers started coming down, and then the mutation in the coronavirus happened. That could be another reason. And a very important reason, there is no vaccine for children. And if you look at the percentage of the number of kids who are there in the infected population with each passing day. The percentage is higher also because the older populations are getting vaccinated, but there is no vaccine for children at this time. Now, this is also a reason why this is such a nightmare for parents. Just consider the following. Infected children need isolation from their parents. If the parents are not infected and the kids are, they have to be isolated. So how can they be taken care of? Parents run the risk of infection and they need to distance no matter what. Just imagine what an emotional situation this can be. Infected parents cannot take care of their kids in such a situation. What can they possibly do? They can wear masks, they can wear PPE kits, but how do you parent in such a situation? It's a huge challenge for COVID new mothers with their newborns. What if the mother is COVID positive, the child is not? COVID positive mums can breastfeed, but it remains a very, very risky business. So children with COVID, it has become a defining feature of this second wave, and it is enough to be taken extremely seriously. It's being written about as a separate trend altogether. Welcoming onto our show, and I want all parents across the country to listen very carefully, because we have the privilege of having people who are dealing with this directly here. Dr. Shalini Tyagi is one of India's top pediatricians. We have Pooja Shali, who is India Today's reporter, who's been who has suffered from COVID in the past, and she has also filed this very hard-hitting story today about the trend of many children coming down with COVID. But I first want to go across to Akanksha Singh. She is a mother based in Gurugram, and her two children, young Reyansh and young Nayanika, all three of you, Akanksha, are COVID positive right now. I can only imagine how difficult this time is for you. So I'd like to start by thanking you from the bottom of my heart for giving us your time. It must be a very worrying time, but just take us through how it happened and how are you coping with it? You and your children are COVID positive.
Yes, we as a family of 6 are COVID positive right now, including my in-laws. And it started with my husband getting the vaccination jab. So obviously, the next day when he got fever, he thought it was a side effect of the vaccination. And, he did tend to overlook it for 2 days. And then after that, he got his test done, which came out to be positive. Then my in-laws turned positive, and then the children followed. And I was, treating them. All of them were isolated in different rooms. For 1 week, I was taking care of them, and then I started showing symptoms too, along with that. So it was really painful to have the children confined in one room where I could not go to them. I could not reach out to them as much, and they had to be on their own to be there for the whole family, and then coming down with it again, yourself, and then doing everything for the whole family in that situation is very, very challenging and painful. So it just went from one to the other. It had to pass on.
I just cannot imagine how difficult that must have been. With your permission, Akanksha, could I just get a word from your two very brave children who are with you, first from Nayanika and then from Reyansh. Nayanika, first of all, young lady, how are you feeling right now? What was it like, to be away from your mother when you were being treated? How difficult was it for you? You are so young and facing this right now.
Oh, well, it was emotionally really hard time. I had to take care of the entire room, make sure it was in good condition. I had a lot of weakness at that time, so it was physically hard to do anything. For the first few days, I was practically unconscious. I was running high fever,
Sitting for online classes too.
Yes, I was doing my classes too amidst that. It was a lot of struggle. It was exhausting mentally and physically. On top of that, there were tons of medicines to keep track of, and it was really exhausting. It was painful and extremely long.
Reyansh, what about you? How are you feeling? What was it like when you got it?
So, like, we didn't exactly know when I had it, but one evening I just got really high fever, so we also got my test done. So that's when I moved in with her, and I couldn't even, I didn't feel like even moving a muscle. I just went there and I laid down in bed without eating my dinner or doing anything.
No, this is...
I felt like I should
Yes.
just sleep. I should not do anything else for that time rather than sleeping. But then I had to keep track of all those medicines also, which was hard. And I was full of a very bad body ache. I felt very weak, and then it was very hard for me to start on with my classes. So, like, I really couldn't I wasn't able to focus a lot in my classes.
I certainly hope that all three of you feel better very, very soon. Nayanika and Riyansh, you're very brave. And if it makes you feel even a little bit better, there are many, many children who are out there facing this same thing as you, all warriors, young warriors just like you. And it is unfortunate that this second COVID surge, Akanksha, maybe you also, I'm sure you have been Googling and reading about this also. The second COVID surge has seen a large number of children being infected, whereas the first surge actually didn't see many children coming down with the infection. Pooja, I want to come to you now. Pooja is our editor who's been reporting on this incessantly. She's been in and out of hospital. She's seen this firsthand as well. Pooja, explain to us what this second surge and why it has been infecting more children than before.
So Shiv, what drew me to this story was because in my own family, one by one, family members started to come positive. Started with my parents who had to even be hospitalized. I also showed symptoms. We have a young child in the family who's only a few months old. So, of course, everybody was in panic. It was a nightmare. It triggered me to call up all the doctors and parents I knew. What we were told by the doctors were that you need to now wear a mask at all times. Newborns are at lowest risk, likely because they are being nursed by the mothers. The mothers can continue to nurse their baby, but otherwise they need to keep a distance. And it is definitely distressing for any new mother to be told that she cannot spend a lot of time with her family. She can feed, which is fine, which is safe, wear a mask, but otherwise a secondary caregiver or a partner needs to take care of the baby. And what I thought is likely perhaps a panic situation for us, I realized talking to people and in fact talking to doctors and speaking to parents that this is an increasing surge. And while newborns and infants are still at low risk, they are getting confirmed positive. The child in our family is relatively safe, Shiv, but we are being told of some severe cases in other families.
This is only increasing, and when you look at the curve, the obvious inference is that the number of children getting infected is also commensurately rising, and that's one of the disturbing parts. And I wish all of these children, because there is no vaccine for these children, there is no vaccine immediately for youngsters, and that may be one of the reasons why the numbers are so high. Apart from all of the other reasons, I am not a doctor. I am also, really just taking these steps and learning along with all of you right now as to where things are going. Before I go to our expert pediatrician, Dr. Shalini Tyagi, I want to just brief you for a moment, ladies and gentlemen, about the symptoms that we've collated from experts about children being hit. Here are the telltale signs that your child might have COVID-19. You should always consult a doctor, but this is what experts tell us. Diarrhea and vomiting are apparently quite common. Rashes, eye infections are also quite common. Vasculitis is another symptom that is seen in children down with COVID. And of course, fever and cough, which is, a generic symptom that's being seen in COVID patients at large, not just children. Now, let me take you through some of these numbers because these are undeniable. 79,688 infections in the 5 worst hit states of the country currently are children. Maharashtra, 60,684. And these were people who were infected between March 1st and April 4th, just over a month. 9,882 in Maharashtra infected are under the age of 5. Chhattisgarh, 5,940 below the age of 5. In Karnataka, 7,327 children infected, 871 are under the age of 5, and you can see more numbers there in that graphic. Dr. Shalini Tyagi, coming to you, madam, you treat children. You are well aware of this trend of many more children falling sick to COVID-19 in this second surge. What has your experience been, ma'am? Are you also seeing this sudden rise in the number of children down with COVID?
Unfortunately, yes, Shiv. So if I say, I'm seeing around 25 to 30 children per day suffering from COVID. So that is an experience that I would like to share.
Yes.
But to add to it, there's a good point to it as well. The severity of the disease that we figured out in children is much less.
Thank you.
So
Thanks for saying that. I mean, that's something that's going to really reassure people. Yes, ma'am. Please continue.
Yeah. So the number of children are definitely more, but we have very limited experience as far as treating and seeing children with COVID. So we'll get wiser with time. But so far, so good. We haven't seen much of severe diseases. There's one more point as well. Now that we are 1 year old with COVID, we know the disease a bit more than what it was a year before. So now the doctors are trained, all of us are trained to identify the severe signs, when to actually when is the right time to intervene and to prevent a disease going from mild to severe one.
Yes.
So that is also it's helping children at this time. But yes, the surge is high.
The surge is definitely high. Akanksha, coming back to you, how are you managing? See, I am sure that there are thousands, if not lakhs of parents who are tuning in right now and watching this show and who've already got in their minds, what will I do if I get COVID and my kids don't have it? Or if my kids get COVID and I don't have it? It's a complicated logistical situation. How did you navigate and handle all of that? Because people are wondering, how can I isolate my child? How can I take care of them? Akanksha.
You are absolutely right, because under any normal circumstance, when the children are unwell, the mother is always by the side of the child, you know, to nurse the child back to health. You can give cold packs, you can give medicines, you can feed with your own hands. But this is such a helpless and sad situation that you just cannot be there. We have been eating out of disposables. The children have been on their own, but it has been a learning course for them also, to take care of themselves, to manage all by themselves, to take their medicines on time. For my son, of course, I had to stand in the doorway and give him his medicines because there were so many of them and he couldn't take them. But my daughter took them on her own. And obviously, she had to be constantly reminded to take her medicines even now. But they have been good on their own. I think, when we let the children be also on their own, they can manage. And it is the initial anxiety that actually is painful. But during the course of the period, everybody takes charge and we all did well. So the children were quite courageous and they got out of it. I think after 7 days, we all could move out without our masks. We all were out of our isolation, still homebound, but out of isolation.
Akanksha, was that an emotional time? I'm sorry to be asking like this because, you were all in separate rooms and, when all of you tested positive, I know it sounds horrible to say it like this, but finally you could all be together.
Yes, it was a very emotional time. We were actually counting minutes and hours, when we would actually get together. My son was actually like, okay, can I hug you tomorrow? Can I hug you day after? When can we hug each other? So it was actually very, very overwhelming when we all came together, after our self-quarantine isolation got over.
Yeah.
And you do realize what a family is at that point and how helpless we were for those 7 days when we all could not be in each other's rooms to be there for each other. I could not be there for my in-laws in their room because that time I was not positive. Then I turned positive, so I could not go to them to reach out to them. My mother-in-law is she's epileptic, she's in a very bad state of dementia also right now. She had a brain hemorrhage last October and she was operated and also she was still coming out of it. She has taken a very bad, COVID has taken a very bad toll on her right now at the moment. And obviously, we are not allowed any help from outside also at the moment, because we live in a society and there are certain norms and certain regulations that we need to follow.
Absolutely.
So nobody is allowed inside our houses till the time the whole quarantine gets over, because mine started late, so it's going to be finishing in another 2 days. Yeah. And that's when they will allow any outside help to come in.
Incredible.
So it's been a very, very difficult time.
You know, this is Akanksha, correct me if I'm wrong, but you know, this is one of those situations where only some of you having COVID is a less difficult situation than or an easier is a more difficult situation than all of you having COVID, because if only a few of you had COVID, then you know there is no access, there is a logistical issue within the house. But with all of you having COVID, and believe me, I hope all of you recover at the same time and on the same day, so you know all of you can have an even more emotional reunion. But before I go to Akanksha's children once again, because they are the youngsters suffering, they are the ones who are part of this trend, I want to show you some data. Data that suggests and confirms that children being infected is very much a defining feature of this second wave. Sneha Murdani with this report.
The long-standing belief that children do not get moderate or severe infection in COVID-19 is getting challenged now. In India, there has been a stark difference between the first wave and the second wave of infection that seems to indicate that children too are extremely vulnerable. Data from the Union Health Ministry shows that over 79,000 children have been infected in the 5 states affected worst by the virus. In Chhattisgarh, over 5,000 children have been infected by the disease. 922 of them are below the age of 5. In Karnataka, the corresponding figures are over 7,871. In UP, over 3,000 children have been infected and 471 among them are below the age of 5. The data comparison for cases of child infection in the first 15 days of April this year compared to over a month's data from last year shows that the doubling rate in children is increasing.
Multisystem inflammatory disease in children is one of the complications of COVID-19. It is seen as an inflammatory response to COVID antigen. The symptoms can vary from mild fever or sometimes to late complications like heart failure, myocarditis, and sometimes shock and death.
The World Health Organization in the month of October had said that COVID-19 is much less frequent in children than in adults. Children and adolescents represent about 8% of the reported cases and 29% of the global population. But this seems to be changing now. So when should parents get the child to the doctor?
Patient having severe pain in abdomen, patient having rash over whole body, and any fever is persisting more than 5 to 7 days. And there is some general red herring sign we call in pediatric, if baby is not able to take orally, if baby is continuously vomiting, or there is some abnormal movement in form of seizure because they are having high grade fever, they should seek doctor help.
The need of the hour perhaps is to vaccinate children, to in fact look whether the trials are providing some protection and eventually then give them the vaccine against COVID-19. Because in the first wave, they were asymptomatic carriers of this infection. Now they're developing severe infection. In New Delhi, Sneha Murdani for India Today.
I want to go back to my 2 young friends who are COVID positive, Nayanika and Reyansh. Reyansh, to you first. You know, kids your age love to play. You know, you're always touching your faces. You want to go out. You want to have a good time. How are you tolerating all that? With COVID, you know, there are so many things you can't do. So how are you managing, Reyansh?
Like, it's really not happy and I'm not able to do all this. But sometimes I just look out the window and I watch the nature, I watch everything, and I just manage with whatever I have at home. I'm happy for what is there at home.
That's very nice to hear. Nayanika, what about you? How are you passing your time? You know, I know already for the last 1 year you've gotten used to it. You've only got COVID now. But how are you passing your time?
There's not much difference in what it was before, like when I got COVID. I read books. I spend a lot of time on the laptop. I sometimes play board games with this guy, and we just try to spend time together as a family now. Otherwise, there's a lot of work for me to do from school, so that keeps me occupied.
Okay. Dr. Shalini Tyagi, what is your advice for parents out there? You know, there are lots of pieces of advice, and you know we've just run through parents with the things that they should look out for in terms of symptoms. But you know, let's face it, there are so many uncertainties in this. Children tend to fall ill. Not everything may actually be about COVID. Can you tell us, because there are parents watching, what do they need to look out for? What is the to-do list as far as children with COVID is concerned?
Yes. So the first thing that we need to understand that COVID is like any viral disease. And like viral diseases, it will have fever, cough and cold, and some body aches, some vomitings, etc. Now the pointers which we should be worried about when we need to, inform the doctor or be on our guards is a high-grade fever, that is 102, 103, which is persisting more than 3 days, or any fever which has been there for more than 7 days. Or other signs, the child has rashes, too many loose motions, he's breathing fast. And, everybody has a pulse oximeter at home. And if the saturations are dipping. So these are the signs I'm sure every doctor has been saying, it's there on social media and all of us know, but we need to remind ourselves all these things. As regards, the isolation, the quarantine and spending a good quality time. So what we've seen is, especially with the teenage girls, they are getting depressed. So we really, really need to find something positive to do, something to keep them busy as well when they are in isolation and they're not actually sick. So just involving themselves in household chores, as Nayanika said, she's busy working with, the maids are not coming and it's just so much of job.
Yeah.
So that is one way. Reading good books is another way. Family quality time spending with family, so many board games is another way. So yes, we should find something to do which is productive and not be on the screen and just be a passive listener to the continuous blabbering. That might help.
Okay, all very good advice. Akanksha, what kind of advice would you give to parents? Because, people watching this show, I don't want to worry them. And, they are going to take a lot of strength when they see you, Riyansh and Nayanika, because they're going to see three people who are facing this with a great deal of strength and calmness. And I think that is something that's going to inspire a lot of people. But we all know that what you're facing is very, very difficult. It is taxing on you mentally and physically. So I want you, Akanksha, to give us some tips to parents out there on, what to do when you find out your kids have COVID and how to do it.
You have to be mentally prepared.
Yeah.
You have to plan everything. You have to plan that this is how it's going to be. The first day is difficult. Second day is a little less difficult. Third day, again, the intensity goes down. Because from the first day, when you change the routine of the house, when you actually lock people up in their rooms, it is very difficult for everybody. The automatic, the action that everybody wants to do is open the door, speak out, call out. But, to get used to not opening the door and just asking for something from inside is difficult. So it takes 2 days for that to come into action and practice. Second thing is that children cope very well with anything. It is all in our minds that children will not be able to do it. My children have even changed their bed sheets in their rooms. They have never done that before. And they have cleaned their toilets, they have cleaned their room, they have broomed it up, and they have, taken care of the whole place. So it is all in the mind that children cannot do it.
Yeah.
But they can do whatever they are put to. So it was a test for them and they have passed it with flying colors. So, and children actually can cope very well with this. Children have milder symptoms than the elders.
Yes.
And, they come out of it also faster because their spirit is very good. It's better than us. And if we don't let our spirit break, nothing like it. We need to stay positive in all situations. Just need to find the solution you don't have to look for the problem, you have to find the solution. So everything works out ultimately. And you have to be prepared, you have to be ready for any kind of eventuality. Of course, keep your pulse and oxygen in check,
Yes.
constantly, and you're sorted. Stay hydrated, eat properly. The children didn't lose their smell and taste, but we did. And it's being horrible, because we want to eat and we can't taste anything and we're feeling hungry, but it's, of course, we know it'll pass. So we are waiting patiently for this time to pass. And tomorrow will be a better day. So, yeah, hope. All living with hope.
Riyansh, are you missing your friends? Do you keep in touch with them? Do you talk to them on the phone or on Zoom or anything like that? Because, isolation can be difficult even for adults. So I'm wondering how kids are coping with it.
Yeah, we can communicate well. We chat with each other.
Nayanika, what about you?
I've been in touch with them, especially since the last 14 days. They have been amazing. I talk to them, I chat with them. Of course, I'm with them for half the day while we're going to classes, so that's good.
I certainly hope that, all of this will be over soon and we can all meet, with our masks on, because I'm sure that young kids like you, that's what you want to do. You want to get out there and socialize and meet with your friends once again. Pooja, with this increasing number of, child cases of COVID, how are Delhi's hospitals, childcare centers, how are they equipped? Because we are seeing a mad rush for hospitals elsewhere. Please tell me that kids largely don't need hospitalization. As Dr. Tyagi said, thankfully, the children's cases are less severe than the adult cases.
Oh, that's a very important question you've asked, Shiv, because that's what I had started to prepare for. And we realized that the beds are filling up fast. And if there are already beds that are filled up for adults, it is very unlikely that the hospitals are prepared for pediatric cases and the age group of 5 to 12, where usually a parent will also have to be accompanied, and often it is a mother.
Yeah.
So there are children hospitals, the one I interviewed, but I can tell you that if the symptoms are all right and mild, doctors will advise the parent and the child to try and recover at home. And importantly, and I can say this from experience, that this year is definitely much worse in the manner in which I felt the symptoms, my family did. But because we were thinking of what next to do, we realized that it is best to stay home till the symptoms are mild. I was constantly asked by the doctor, if the symptoms get worse for either of you, you need to contact and rush to the hospital. And there are, of course, child specialist hospitals that are already preparing for the facilities. Shiv.
Okay, so there are facilities are hopefully ramping up and looking at this particular trend. And I hope that, such resources are never necessary, because we want whichever child gets COVID, we hope that home care is more than sufficient and no one ever needs to be admitted to the hospital. And whichever, few cases need hospitalization, I hope that, beds and resources will always be available. Is that the case, Dr. Tyagi? Final word to you. Are there any recommendations you can make as a pediatrician? Because you are in the trenches and you are fighting this yourself, with the children who come to you. Are there more resources that are necessary, or is India prepared to protect the children who get COVID?
Oh, no, I really don't think so that we are prepared enough, with the surge coming in, number of children coming in. No, even though when I'm saying that the number of severe cases are way less in children, but with the enormous amount of, people getting infected in numbers, even if the complication rate is less, the total number of children requiring a proper treatment, ICU cares, is definitely going to rise. And yes, we do need our resources to be in place.
Yes.
And presently, I really don't think, especially in the smaller part of our country, that we are adequately prepared. We need to gear ourselves a bit more.
As a parent of a young child myself, I can tell you that I've learned a lot in the last 25 minutes, and I really value the words of all of you today. Akanksha, Nayanika and Riyansh, get well soon. Hope to see you bounce back very, very quickly. Thank you for your precious time. I hope these 25 minutes have been interesting for you as well. I can tell you that lakhs of people across the country have seen you and heard you and been inspired by your story. Thanks also to Dr. Tyagi and to Pooja. Get well soon to all of you, and I hope to see you in person very, very soon. Thank you very much for being with me here on 5 Live.
Thanks.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.